It's time for health tips. Now here's your host, Dr. Alma Jenkins.
Good evening. Thank you so much for watching. I'm Dr. Alma Jenkins and this is Health Tips. As I promised, this week we're going to talk about hepatitis, particularly hepatitis C. Now, just to give you a background about that, I'm going to tell you a few things about hepatitis in general. But before we do that, let me say a few things that we normally say when we start, and that is that we would love to hear from you. So if you want us to speak to your group, your church, your organization, drop us a line. We'd love to come to your organization and give you some information to help you better take care of yourself. Not only that, but when we do recipes, I think last week we did the juice, and I've asked you to see what you can do to tweak that some. It's already delicious, but you may want to tweak it. We used pineapple, apple, carrots, and then we did some honey water in there. And we blended that to death, and then that was our juice. I didn't even peel the apple. The apple still had the peeling in it, and I put all that in the blender. So we got plenty of fiber in that recipe. And it kind of is a cross between a juice and a smoothie. You can put more water in it if you want it to be a more watery thing, or some of you have juicers and you just put it in your juicer and you're going to get just pure juice and it's going to do away with all that fiber. But I like the fiber, and the colon loves the fiber. So I try and make something that I can use all of that. Of course, we had to peel the pineapple, and then we peel the carrot, or at least scrape the carrot to get the outer skin off. But it was delicious. So if you want to tweak that, like you might want to put cinnamon in it, or you might have some ginger in it to get a gingery taste. There are all kinds of ways you can tweak it. And I'd be curious to see some of the ways that you would tweak that recipe. If you'll send that in, we would love to have it on the air. And we may ask you to come on and show us how you did that. All right? So that gets that out of the way. Now what we're going to do is talk about hepatitis. Now, I know that some of you remember I have talked about hepatitis before, but these are some kind of nice pictures. I got them off the internet. I have to give credit to WebMD, which you can go to yourself and see this. But this gives me a chance to kind of talk about it with some pictures to help us. A lot of times we hear talks, but when we can hear and see, it really is helpful. When you have something you can visualize along with what you're talking about, then that makes it really, really relevant for you, doesn't it? It really does. Now, many of you have either had hepatitis, or you know somebody with it, or someone in your family. It's a very common problem. So that's one reason I want to do it tonight. Now, the word hepatitis itself simply implies that the liver is inflamed. Now, many of you have seen, you are familiar with that last ending itis. We have arthritis, we have gastritis, we have esophagitis. So when we attach that itis to it, that means that something is inflamed, okay? So if we attach it to our stomach for gastritis, the gastric mucosa, it means the stomach lining is inflamed. If we attach it to hepa, which means liver, then the liver is inflamed. So that itself doesn't tell us exactly what's wrong with the liver, like what's causing it. So it could be caused by a virus, in which case tonight we're talking about hepatitis C. So that's the hepatitis C virus. Certain medicines can irritate the liver. We call that a hepatitis. Okay? Certain bad foods can do it, such as poisonous mushrooms can throw you into liver failure. Okay, so you really have passed the itis point. You're actually broken down. So, so various things can give you a hepa, meaning liver, hepatitis. Okay, we're talking tonight about viral hepatitis, and hepatitis C is a virus. Okay, so obviously if there's a C, you think there must be an A and a B, and there is. There's A, B, C. There's also D, and there's even an E. But we're focusing tonight on C, okay? Many of you know that hepatitis A can be gotten in nursing homes, daycare centers. You pass that through contaminated food, stool. People don't wash their hands and fix you a salad and they've got hepatitis C virus in it. You could, hepatitis A, then you can get it too. You know what's interesting? Years ago, I rolled up to a fast food place, and the gentleman who came to the window had yellow eyes. Clearly, he was jaundiced, and I could not let him fix my food because that guy appeared to have a hepatitis of some sort or some kind of liver disease. And I don't know if maybe the manager didn't know he was coming to work like that, but clearly, if you're jaundiced, you shouldn't be fixing food because the public isn't going to trust you. They don't know what you have. You obviously have something, and viral hepatitis can give you that depending on what stage and that that it's in. So that's just one example. And being a physician, I had knowledge of that. So that prompted me not to put myself possibly in harm's way. And that's what you have to do. You have to use your own gut and instinct on things. And if your instinct tells you, no, I'm not going to do that, you might not fully understand it, but you have to go with it. It got you this far. And my instinct told me, no, let me go to another fast food place, And I'm sure he got that response all during the day because most people who know anything about that aren't going to want you to fix them a sandwich because they don't know what you have. All right, so let's get going here now. We're going to talk about hepatitis C, and I'm going to show you these beautiful slides. Let's get started. Okay, so this is from WebMD, and we're talking about hepatitis C. This is trying to represent the virus, hepatitis C. And this is, of course, your liver. Notice where your liver is located. It's on your right side of your body, okay, and it's underneath the diaphragm. The diaphragm separates the chest from the abdomen, okay? So the diaphragm, that's a muscle that lays across this area, separating your chest, where your lungs and your heart live, from your abdomen, where your liver and your guts live, okay? Now that's different from your pelvis. For us women, our pelvis is where our uterus and ovaries live, okay? So you got three major compartments: your chest area, your abdomen area, your pelvis, as you know. So let's talk about Hep C. Hepatitis C is a liver infection that's caused by a virus. About 3.2 million Americans have it, and 17,000 or so others get it each year. If left untreated, it can lead into lifelong liver disease. How do you get hepatitis C? The most common way to get the disease is to share needles or other equipment used to inject lethal, illegal drugs. A healthcare worker might accidentally be stuck with a needle used on an infected patient. It's rare, but you can get it at a tattoo parlor if the equipment isn't clean. You can't get it by kissing, hugging, or sharing eating utensils. Now, that's important to know because many of you have some concerns about how you would get hepatitis C. And even the needle sticks that we can get at the hospital, you can get it that way, but most people don't get it that way. It's not all that easy to get it that way. We have to show you that you can because that's a possible way, but it's not the most common way. And I can tell you something too that's very interesting. If you're monogamous and your partner has not, you're not with different people and all of that, but you're monogamous and you've been with this person for a long time, and maybe they have a Hep C, we don't really have what we would say is a rule that says, okay, you can't have sex with this person or or whatever, some people do use protection. But most of the time they're okay. But of course you certainly can, and on the side of caution, you may feel more comfortable to use protection. But clearly the more common way that people are getting it is when they have multiple partners, or you are using IV drug users, and that was important what they said about the tattoo parlor. You might not think about that, but that's an intimate contact because they're using a needle and injecting you multiple times to do the particular image that they're trying to get on, and they're doing many people. So you want to be very careful and go to a reputable place that's using sterile equipment when you go and get these tattoos. That's so common and popular now to get a tattoo, and I'm very concerned about the number of people who are getting them, that they're having safe practices to get those tattoos done. So that's something to remember. And even when I go to a nail parlor, I'm very concerned about what they're using, particularly because they cut some of them will cut your cuticles. I always tell them don't cut mine, but they cut your cuticles. So you want to make sure they're using clean equipment. I'm very comforted when I see them take it out of a new plastic bag that they put together to put the sterile equipment in, and so watch what's going on where you go. Don't just go in there and take for granted everything is just fine. I usually try and observe what's going on. And if you've been going to the same place and you know they're reputable, then you have less to be concerned about. But this is just to put you on guard that when people are doing things to you that involve access to your bloodstream, just remember that you can always get something if the equipment is not clean. Okay, that's different than somebody cutting your hair or somebody washing your skin for something. But when they actually start cutting and putting needles into your skin, that's, we got to be careful with that. All right, so we talked about how you can get it. Who gets it? Baby boomers are most likely to have the infection, but we're not sure why. Some boomers were infected before blood screening methods changed in '92. Others got it from injecting drugs, even if it was only once. If you were born between 1945 and 1965, the CDC suggests you get tested for hepatitis C. Did you hear that? Go get tested, okay? What are the symptoms? Some people who have hepatitis C won't have any symptoms at all. If they do, they might include fever, nausea, vomiting, or stomach pain. You could be tired and not feel hungry. Because those symptoms can be the same for a lot of illnesses, see your doctor if you don't feel well. Now, having said that, please know that hepatitis C, when you first get it, you may not even be aware of it. Many people are carriers and are unaware, okay? So you just might not know that you have the virus because you may not get, quote, sick, unquote. You're not having, you're not throwing up maybe, but then you might. You're not home in bed. You're working every day. You didn't even know you had it. So it can be symptomless, or it could be a brief period of a flu-like illness and you think you may have caught, a virus. Well, you did, but it was a hepatitis B virus. But you may think that you have maybe you're catching a cold or something, all right? Now, a lot of you have seen this, people with the yellow eyes. Remember I told you about the fast food worker who wanted to serve me something, but he had yellow eyes? Now, I'm sorry you're hearing that noise because there's some yard work going on outside. It's important to get treated. If the disease goes untreated for many years, it can damage your liver. It can also lead to liver cancer, liver failure, or scarring of the liver, which is cirrhosis. Now, that is called jaundice, when your eyes get like this, and that can be caused by several different things, hepatitis being one of them. Cancer can be another that can cause yellow eyes. Okay? How do we diagnose it? Doctors can tell if you have the condition with a simple blood test. If the test says you have hepatitis C, your doctor will likely do other tests to confirm you have it, so you can start the treatment right away. Now, if you're found to have hepatitis C even, then we're going to test you to see which type of hepatitis C do you have. It comes in various genotypes, kind of like things come in flavors, you know. Genotype 1 is the most common genotype in this country. So most people are genotype 1, and genotype 1 is the one that is easiest now to treat as far as the medication that we have on board to treat it. Okay? All right. Drugs called antivirals and treat hepatitis C. A new drug, Harvoni, is a once daily pill that combines Sovaldi and I'm going to pronounce this word, you may be never asked to say it, but ledipasvir. It cures the disease in most people in 8 to 12 weeks. Other options include a combination of Sovaldi, interferon, and or Rebitol or ribavirin. Ask your doctor what's best for you based on your medical needs and insurance coverage, since these medicines are pricey. Let me just tell you that the treatment is very expensive. Most of the insurance companies will cover some form of treatment, but this is where you have to have a little knowledge and press the issue. If you have hepatitis C and your insurance company is giving you a decline, I suggest that you follow up. Call that company. Find out why they declined you. Okay? Because it's going to be more expensive than you can probably afford to pay out of pocket. But the more you know, the more you can ask, the more likely you are to get a favorable answer. But the difference now and in the past is that the Harvoni has done the trick in about 12 weeks. Before, we've had to go for 24, 48 weeks to treat this disease, and then we weren't sure it would be treated. You know, the cure rate was not nearly what it is now. We're about over 90%. So this is a virtual cure for hepatitis C. So check with your doctor. You're going to have to get to know which genotype you have, because the Harvoni specifically, or more specifically, successfully deals with in 12 weeks genotype 1. Okay? Now, the other thing is we are sending off to see whether you have cirrhosis or chances of your having cirrhosis. Used to, we would just biopsy people, but there's a test now we can do that kind of gives us an idea called FibroSure. So we get that, and we get other blood work. We check how well you coagulate, all those things to give us direction into how well you're doing and what the status of your liver is. Okay? Now back to the screen. How do we take care of ourselves? There are no special foods that help fight hepatitis C, but it's always smart to eat a healthy, well-balanced diet. Avoid alcohol, which can make your liver worse. Get vaccines for hepatitis A and B, pneumonia, and the flu. Talk to your doctor before taking any prescription or non-prescription medicines, especially Tylenol. Now, I want to say a little bit about that. If you're a person who's had chronic liver disease, meaning you've had hepatitis C for a while now, you should also make sure you're vaccinated against hepatitis A and B, and that you have gotten your flu vaccine, okay? That you've gotten your flu vaccine and pneumonia vaccine. So this is so you don't get these illnesses, because that could be extra hard on you as a hepatitis patient. And then try to eat healthy. You're not a candidate for treatment if you drink, okay? So you have to not drink for the treatment to be effective. We don't generally start treating people who are still drinking, Okay, and that's, that's a sad but true fact, because it can make things worse. All right. Okay, so get the latest on the drug combos that can fight hepatitis C, because things have gotten better. Don't gorge yourself on fast foods. Let me get that so you can see it. And then there are other slides on here that you might want to look at that would be helpful to you, okay? But I wanted to just stress the fact that there is help for you with hepatitis C. Now, I didn't talk about type 2 and 3, genotypes 2 and 3. Those are also treatable. The treatment might be a little different based on your insurance coverage and all of that. We try to work with all of that to get you what you need. Okay, so I hope that was helpful to you tonight. We talked about hepatitis C. We talked about possible symptoms, how you get it, the new medication that's out now to treat it is called Harvoni. And then there are a couple of new ones after that that are out that we can treat it with. So I want you to be knowledgeable, because when you go in to see your doctor, you can ask about all these things, especially if you are a person who has hepatitis C. All right? So let's do some exercises. Now, I always want you to stay healthy and moving. In that fact, Michelle Obama and I are on one accord. All right, you ready? 1, 2, 3, and 1. And 2, 3, and 4, 5, and 6, 7, and 8, 9, and 10. Let's do 15. 11, 12, 13, and 14, and 15. 2, 3, 4. And remember, I said that hepatitis A is generally not intimately spread. Hepatitis A is from food, contaminated food, contaminated, and that includes, you go to the bathroom, don't wash your hands, you have hepatitis C, someone gets a hold of that. In daycare centers where kids are, dealing with each other, they don't know any better, and maybe one kid might have been exposed, and they're around each other quite a bit, and perhaps there's, one kid's handling his bottom or something, they're sticking their fingers in each other's mouth. Those kinds of things. I mean, nursing homes where patients may have it, and workers may be dealing with their body fluids and not washing their hands, and you somehow get to ingest something that's been contaminated with the hepatitis A virus. But on the other hand, hepatitis A usually clears up fairly quickly. You don't generally get chronic liver disease from hepatitis A. So B and C are the ones that you can get chronic liver disease from hepatitis B and C, and you don't generally get it from hepatitis A. Okay? So that's something good for you to know. Many of us have been exposed to hepatitis A and we didn't even know it. So when our doctors check us, they see that we have antibodies to hepatitis A, but we don't remember when we had it, or never knew we had had it in the past. All right, so let's go now. 1, 2, ready, and 1, and 2. Come on, smile. 3, and 4, 5. You hear the chair squeaking. 6, 7, 8, 9, 10, 11, 12, 13, and 14, and 15, 16, 17, 18, and 19, and 22, 3, 4. Whew, that was great. Let's take a good deep breath. Okay. I'm gonna have to move a little bit. You're gonna have to lift your arms and now let it out. Lift again. Hold it, hold it, hold it, hold it, hold it, hold it. Let it out. Great. You know, a good deep breath is very good because, you know, oxygen is what we thrive on. So you take a good deep breath, you're giving your blood more oxygen. That's good for your brain, good for your heart. It's just good for everything. So get in the habit every now and then, especially when you're stressed, just go ahead and take a good deep breath. Hold it and let it out. And that can calm you too when you're stressed, when you're panicked, when somebody says something got you mad. You know, just stop and take a deep breath. There is something to that. Okay? Now, how many of you remember what we did last time? We did the juice, and I wanted you to send in to me how you tweaked that. So I'm going to remind you tonight. That was pineapple, apple, carrots, and honey water. And we blended all of that. I did not peel the apple. It was a red delicious apple, and it was really good. So I know that that can be tweaked. It's a basic recipe, but you can tweak it with various things, and I'd be curious to know how you tweaked it. So we can try some of the different tweaks because, you know, that's what makes it interesting, right? So I'm going to look forward to hearing from you and how you tweaked that recipe and made it look good, made it taste even better. All right, let's do a little bit more exercise because we can never quite do enough on the show. Time goes by so fast. So let's just stretch our arms out. Ooh, you know, that feels good. Feels almost like you want to yawn. You know, I do want to yawn. As a matter of fact, that means it's very, very relaxing. And let's put our hands up in the air like this. And let's go 1, 2, 3, 4, and 5, 6, 7, 8, and 9, 10, 11. You'll start to feel this. 13, 14, and 15, 16, 17, 18, 19, and 20. Ladies and gentlemen, it's been so much fun. I'm Dr. Alma Jenkins. Thank you for watching. Good night.